One second. So,
Dr. Kiran, you'll have to minimize the Zoom app and then you will be able to see your screen. Yeah, perfect. You're on mute, sir. Yeah.
okay. So, good evening, one and all. This is Dr. Kiran Kumar Gulve. So, as Harsha Madam discussed regarding cortical visual impairment, so awareness month. So, I would like to highlight practically about CVI as I am practitioner. I'm not a full-term, definitely theoretical speaker. So, we'll start. So, outline cortical visual impairment, CVI. So regularly case studies and regarding autism and also ADSD. So these three topics we are covering today. So cerebral cortical visual impairment. Visual responses due to the neurological problem affecting the visual part of the brain. So definitely CVI initially we don't have proper treatment right across the world actually. So nowadays definitely few developed countries they started vision therapy and all. So also in India also we are planning to like within the district level. So at present we have only metro cities vision therapy. So initially we don't have even though behavioral vision therapy within the India. So now within the Hyderabad, we have almost 9 centers. So we are full-fledgedly giving this vision therapy for all the children yeah, with the CVI people also. So prevalence, cerebral cortical visual impairment is the leading cause child blindness and low vision. CVI is the lifelong brain-based visual impairment. So definitely there are so many people even though villages and nowadays also we find out so they having blindness kind of low vision or else like CVI kind of cases or else like amyloidic cases. So still they are not approaching to the hospitals and they are just suffering like that only. So caused by damages to the brain visual pathway and processing the area, right? So we feel like eye is normal. So we are when we are doing in pediatric cases dynamic retinoscopy, so we get like a very good glow. So we feel like yeah child is growing good only, right? So after few months, so child is not fixating their eye movement, so he's not giving proper eye contact, he's not holding the objects. So then started the child suffering age actually. So about 30 to 40 of the children with visual impairment having CVI cases. So CVI prevalence of 10% of all the children, developmental disabilities. So different disabilities we have. Also visual developmental issues in these conditions, delayed visual maturation. Delayed visual maturation, a cortical visual impairment in which infant has normal eye exam but does not demonstrate typically visual behavior. So behavior wise, definitely people they won't they cannot mingle with the others actually. So they feel like more comfortable with the known people because they go with the mother smell, and things are very particular. They play with the very few devices, I mean like any small kind of objects or colorful pictures. So the visual responses improves in the child with delayed visual maturation and resolve the within 1 year. So how does vision works in CVI? So the eye structure in CVI is normal. So anteriorly, eye takes normal pictures of the objects. So whenever we see, so objects are clearer, right? But send it to the brain. When processing this thing happens, capturing the image and we are sending to the brain within fraction of microseconds, the picture of the object not properly processed in the brain occipital lobe. So due to abnormal brain cortical function, so that's the reason. So children cannot see properly. That may be hazy vision, that may be shaky vision, that may be like distorted vision. So we can say like a number of words in this condition. So damages the posterior visual pathway, can lead distinct characteristics of visual behaviors. A damage to optic tract and radiation tract can result abnormalities of the visual field. So definitely field of vision also they don't have properly. So whenever moving object, if person going in front of him or the child particular, so he cannot give proper eye to eye contact, or he cannot see the field of vision properly. If someone is come here, so the normal child sees like within fraction of seconds, but this kind of child they cannot see. If someone come in front of him, then only he try to pick up his head, and then he'll going to observe, okay, someone is coming, like that. So causes hypoxia, asphyxia, lack of oxygen in the body. So hydrocephalus, CSF fluid, cerebrospinal fluid, cavities called ventricular deep within the brain. Metabolic disorders, different kind of metabolic disorders may happen. So preventricular leukomalacia, type of brain injuries affects premature infants. So mostly we can see premature babies also. So like 6 months, 7 months babies deliver, right? So in that condition also this may happen. So seizure disorders, different type of seizure disorders we have. So whenever child grows, so if attacks with the seizure, epileptic attack, so child improvements goes back again. So in this condition also visual system also get effects. So traumatic brain injury due to the shaken baby syndrome and accidental injuries, whenever like take like a child, so we do like this. So definitely the brain is like very softer in infants, so it should not do very highly, right? So in that case also like a brain function may get affected. So hypoxic is ischemic encephalopathy, type of brain dysfunction, brain injury that occurs when brain experiences decreased oxygen or blood flow. So premature babies, premature birth. So oxygen supply hypoxia and hypoglycemic condition also, definitely this may affect strongly. Okay. So other causes include antenatal drugs uses by their mother and cardiac arrest, twin pregnancy or tri pregnancy. So in this condition also child brain may affect. So central nervous system developmental defects. So definitely uh, central nervous system, whenever mother gets more strain stress in these conditions also may affect this CVI condition. So confusing diagnostics entities include delayed visual maturation, autism spectrum disorders. This one also kind of disorder only, so they cannot see properly. We'll discuss in upcoming slides. So can be congenital, can be acquired, may also exist with other visual conditions such as optic nerve atrophy. There are chances, and retinopathy of the premature babies. So symptoms: dyslexic color preferences, so they cannot find out proper colors. So normal babies, they can identify after 3 months of the age. So primary colors, red, green, blue, so this kind of colors. And in this condition definitely there is a delayed milestones. There's a reason they cannot find out proper colors. So delayed in visual responses, latency, abnormalities in visual field, we discussed. So field of vision, definitely there will be like narrow, and field of vision, unfelt visual stimuli, abnormal light responses, light gazing or photophobia. So sometimes they won't accept light if they go out, so they feel like very uncomfortable, they squeeze their eyes, they different behavior they show in childhood. Unusual visual behavior, avoidance social gaze, better vision when weaving moving objects. So a better vision whenever we move the objects, right? So or weaving the objects, so comparatively stationary objects, better visual responses near objects, comparatively distance. So also distance also within like 2 to 3 meters, depends upon child to child, this may vary, depends upon their severity, mild, moderate or severe condition. So difficulty with complex visual objects, so there are so many objects, different colors, and if we are going to ask them just pick that particular object, they may confuse, they cannot proper pick that proper item. So poor visual acuity definitely. So okay, so does vision improves in CVI? There are so many mothers that come to our organization and they discuss, इसका vision आएगा या नहीं आएगा. So mostly from the North India, so MP, UP, and from the even the Kashmir, also from Kanyakumari. Definitely, most of the people children we find out from North India cases. So they always come with this condition, and they discuss मेरा बच्चा होगा या नहीं होगा नॉर्मल, ये से नॉर्मल लोगों में हम जा सकते हैं या नहीं जा सकते, this kind of question asked. So as the brain matures, new connections develop in the brain, overcome initially injury, defect, improve the function. So whenever the brain matures, right, so age grows, height grows, brain or mental age also grows. So age grows, height grows, mental age grows, but in this condition definitely there is a delay. So if it is like normal condition, so age is growing, height is growing. So normal condition, this should be like continuously simultaneously growth. If it is like in CVI condition or developmental delay condition, so definitely there will be a delay. This growth, this is slow, this growth, this is slow, this growth, this is slow. But definitely early intervention is very important in this kind of cases. It is difficult initially to predict future visual functions. Vision improvement in seen in many children with CVI. So partial recovery of the vision, many children with CVI, and several visual impairment occurs. Improvements are seen visually, visual acuity, orienting peripheral stimuli, attention, and reaching for objects, and for social gaze. So initially they don't have proper brain eye hand coordination, so they may have like kind of vestibular issues also. So like I'll show small video. So this is like slow video actually. He doesn't have proper eye hand coordination, so now he's doing edge to edge properly, eye hand coordination with the brain, right? So with the balancing board. So management, stimulations is helpful for children with the CVI. Large light, high contrast, reflective and moving objects. So whenever we are moving lights towards the child, like within 20 centimeters, so then only he tries to observe like this. He tries to observe. So visual materials presented in simple, uncluttered manner, like presentation of visual material from different directions, angles. Touch and sound attracts child attention. So they always try to touch the objects, and they feel like okay, what is the shape and all. Evidence of overstimulation, evidence of visual task when child hungry and tired, frustrated. So case study. So and so name, age is like 2.3 years, male, joining date. So chief complaint, holding objects near distance and fixating the following the mother face since birth. So using spectacles since 20 days. So we gave like hyperopic glasses because he's more comfortable with the hyperopic glasses. He doesn't have any power. So no head and ocular injuries, no ocular surgical and medications, and no history of family and drug allergic. So history of prior consultation. Okay, so child birth history, C-section, full-term baby. So weight is like 2.300 grams. Immediate birth cry. So 9 days, yeah, hypoxic actually. So 9 days oxygen given in an ICU. Seizures again. Second day only he affected with the seizures. Neonatal jaundice and any other infections. So no other infections actually. So no partial consanguinity. History of delayed milestones. One elder sister. Okay, concerns: no fixating and following objects, not giving eye to eye contact. So rolling of the eye all the directions, unable to hold illuminated and object close distance, squeezing of eyes. So activities are different activities we do for this kind of children. So if it is like no fixation, definitely I told like just previous slide, so we should go with the slow manner, different kind of colors light. So like example, this is like spinning globe, what we call. So this will be going to be like primary colors and slow movements we show. First of all, we need like more patience for pediatric cases, and also if it is like CVI or low vision or else like any other disorders. So definitely we should go with the slow manner because it goes like 6 months, 1 year, 1.5 year, maybe 2 to 3 years also. This kind of therapies. Improvements seen eventually. Improved visual acuity for 3 meters in both the eyes. Improved saccadic movements, definitely we'll go with the starts with the pursuit movements initially, then we works on saccadic movements. So whenever we are going with the saccadic movements, so definitely he may be confused and he cannot give proper eye contact. There's a reason we starts from the pursuit movements only. giving good eye contact to parent, improved concentration and focusing. Whenever child they have kind of CVI issues, so they see like somewhere what we feel, yeah, he is observing my face, but he won't observe our proper face, and he cannot give proper fixation on the lip. So I want water, so this is like lip movement. He should or she should focus on the or fixate on the particular target, but they cannot give initially targets. So this kind of focusing or fixation issues, we worked on this child. Reduce eye squeezing. Okay, so overall, CVI cases are very slow improvements, but there are long term. If you are going with the 2 to 3 year therapy, so there will be beautiful improvements in the pediatric cases. So depends upon age again. So if they visits within 6 to 7 months, that kind of age, or within under 1 year, so definitely we can do like tremendous. Okay, so autism spectrum disorder, it's like we call like ASD. It's a neurological and complex developmental disorder that affects how people interact with others, communicate, learn, and behave. Autism symptoms generally appear in the first 2 years of life. Mostly, people are come within 1.5 year. So, because till 1.5 year, milestones are very good, like mentally. So, what we speak, so at least 1.5 year means 5 to 6 words: mommy, daddy, TV, water, food. So this kind of few words they speak till 1.5 year. After 1.5 year, the regression suddenly happens, so they cannot speak the new words. They won't show interest to learn new words, and they have so many irritating issues actually, poor socialization, that kind of thing. Okay, so the prevalence of autism spectrum disorder, 1% in the world population of 100 children. Autism is 4 times more prevalent in the boys. So definitely there are so many like children, specifically boys, affected with this kind of disorders comparatively female. Causes, risk factors, no primary cause actually. So adopathic, uh, genetic conditions, there are 5 to 10% or maybe 15% chances, yeah, this kind of Rett syndrome and X syndrome, Kabowski's syndrome, this may be, there are chances to affect. So biological environmental factors, symptoms: difficulty in communication, interaction. They have own imaginary world. So if I'm going to call them, like they won't give response. So he knows someone is calling, but they don't turn their face, and they don't want to give eye contact properly. So poor eye contact, the vision seeking behavior, so they keep on do like this, or else like they flap their hands, or it's like somewhere like they see like fans, moving objects they like actually in this condition. So lack of socialization, poor focus, fixation, and tracking skills. So they cannot go slowly. So they want like everything fast, quick responses actually, but they cannot focus also. Mostly speaking skills in the only few words, like we discussed within 1.5 year. If it is like age 3 years child, also the child is mental age behaves like 1.5 year kind of thing. Does not respond to their own name call response. Inappropriate facial expressions. If I smile, so they won't smile. If I cry, they don't have proper emotions. Depends upon risk to autism or mild autism, or else like moderate to severe or severe autism. In mild cases, definitely they improve beautifully, and also they give few responses. If it is like moderate or moderate to severe condition, they don't have proper this kind of responses. Repetitive behavior mostly, so they do like they play with the one thing like hours and hours, and they are very particular with a few shirts, or just like few cloths, or just like few things. So they're having so many distractions actually. So management is like behavioral vision therapy for this kind of children. Case study: 7 years of child having issues, hyperactive, lack of attention, behavioral issues, poor eye contact, poor socialization, distractions, diagnosed with autism, underwent BVT, behavioral vision therapy for 8 months, improved with good eye contact and reduced distractions. Yeah, about sign after 4 also we use in some cases, definitely for vision stimulations. They'll sit for the longer time, that's the reason. And this is like we are throwing balls for full-fledged binocular vision they have or not. So this kind of activities we do. ADHD. So this is the leading one of the disorder in the India also. Nowadays we are seeing so many cases in children, ADHD condition, attention deficit hyperactivity disorder. This one also a neurological disorder with attention hyperactivity and impulsivity. ADHD often co-occurs with emotional, behavioral, language, and learning disorders. Prevalence approximately 6.5, 366.3 million adults worldwide we have presented ADHD from childhood. It is estimated to affect about 6 to 7% people aged under 18 years. Type of ADHD. So hyperactive disorder is like AID, attention impulsive disorder, ADD, attention deficit disorder. So both the hyperactive disorders only. Causes, there are chances again 5 to 10% or 15-20%. So from the genetics, this one also like idiopathic. Preterm, there are chances low birth weight, there are chances excessive screen time after 6 months, or few mothers they are giving like at the age of 3-4 months only. So this is very dangerous for children, any mobile or any digital gadgets. So this one also exactly unknown cause only, because not only India, across worldwide, research is going on ADHD also. So mostly we avoid actually sweet products or wheat products and milk products for this kind of children. So symptoms are hyperactive, lack of focusing and fixation, poor in ocular tracing, tracking, similar kind of symptoms only compared about autism and ADHD. Emotional yeah, emotionally having trouble staying seated, poor in visual motor integration. So behavioral vision therapy we gave them. Okay, case study is 5 years child having issues with hyperactive impulsivity, poor eye contact, writing issues. So definitely they want to do immediately everything, so they cannot sit at the one place properly. So they have so many distractions. If I see like hey Rajesh, come here, so he listen and he just come, and he just immediately go within fraction of second, and he just distract like anything there and here. So if you're calling, just he give bit attention, and again he having different kind of distractions. So sitting tolerance is low, distractions, and diagnosed with the ADHD, underwent BVT for 9 months, improved with good eye contact, reduced distractions, and improved attention, sitting tolerance, and concentration. So we have this video. This is like she doesn't have proper eye contact. She's not looking at the beats. So we are practicing group string also for this kind of children. Uh, After that, after a few months, now you can see the concentration, sitting tolerance, and focusing on the particular objects with the verbal communication properly. Okay, so in hyperactive kids, yeah, they having proper like speech. Comparatively normal children, yes, there is a delay in ADHD also, because this one also disorder. So in the initial stage, if we are start with the therapist, so definitely there will be beautiful improvements in this kind of children. So age is very important. So like we starts from 1.5 year about ADHD or else like autism kind of children. So these therapies are very beautiful for a longer time, like 6 months, 7 months, or 1 year. So we gave like 9 months. So it takes time to control their attention, sitting tolerance, eye contact. So then only they can speech properly, right? If they have like this kind of issues, so they cannot see facial expressions, right? So definitely they cannot capture what we are saying, ra la. So this is like very 2 variation, ra la, right? So they cannot copy and imitate. So that's the reason speech is a bit delayed in ADHD also. If child visits to under 2 years, so there will be a 80-85% or 90% improvements we can expect. If it is like above 9 years, definitely we cannot do anything, we can just modify their lifestyle. So we cannot give any beautiful improvements, because our brain almost grown till 9 years, so we cannot mold after 9 years. That's the reason we takes like under 9 year children in our child development centers. So this is feedback. Yeah, we having almost 500 and 600 and, sorry, 6,500 success story as vision therapy. So we having almost now 10 branches. So 9 years of experience in this field. So we having almost 200 plus staff. So yeah, we achieved last time from health organization, health minister, best child development center. So yeah, these all are like our branches. Thank you.
And thank you, Dr. Kiran. It was an
Yeah.
amazing talk and amazing cases, and I must say, lovely results actually after the therapy. Uh,
Yes.
you have made difference in so many kids' life. So let's take the questions from the audience. The chat box is flooded with the questions. I'll start one by one.
Mhm.
Um, okay, the first question is, can CBI be detected in gestational period?
No, in gestation we cannot definitely. So because the yeah, if it is like genetical disorder, yes, we can.
Okay, okay, okay. What about the grades of CVI? Were there any retained primitive reflexes found with the child in the case study? I think this is regarding the first case study what you had presented.
Mhm. Okay, so it depends upon their condition actually. So children with come with their vision. If we are going to assess within, if he is like find outing objects, so definitely we can consider like yes, the child can get vision in future if you are providing this therapy. If he is not giving any eye contact or any eye movement, so definitely we cannot expect if you are providing a good therapy also, so there will be a less chances to improve their this kind of children vision. And also for CVI, yeah, only vision therapy is the solution. So however, like we don't have proper surgeries for this, so we can distinguish like mild, moderate and severe condition.
Okay, okay. Thank you. The next question is, how do you measure saccades?
So it depends upon time. So if it is like we are giving 2 fingers, so we ask to the patient, so try to focus on right left. So depends upon seconds, we just start with the second watch. So we consider like that only. So if he is giving like within fraction of seconds, so definitely this will be going to be like normal. So there will be a delayed response. If I say like look on the right, so he give right, so left he give slowly left. We measure the time and will consider like how much time it will take. So every child they having like own delayed responses in psychotic moments.
Right, right. Okay, the next question is, as these kids are slow learners, does Government of India has some laws for them? Like anything
Yeah,
special in
there are.
schools or for jobs?
Okay, so yeah, there are the chances we have in the Hyderabad, not only Hyderabad, all the metro cities, National Institute for this kind of children. Initially, in Hyderabad also we have NIPMED and Chennai and Bombay. also Bangalore. So we having from the government this kind of schools. They are providing education, and they are trained to the parent how to improve the vision and all. So they give like different therapies also, not only vision therapy, like occupational therapy, and depends upon child to child behavior therapy also needed.
Okay. Uh, okay, I think this question is related to the optometrist role basically. So how can optometrists engage themselves in primary investigations?
Okay. So basically, first of all, in India, very few optometrists are practicing this vision therapy, what we
Right.
call like
Yeah.
visual vision therapy. So very few rehabilitation centers we have for pediatric cases. Yes, of course, for addiction rehabilitation, that's like different part. Uh, yeah. So within Hyderabad, we started 10 years back. So that time, privately, we have first center in Hyderabad. So we started like that. So right now we having like almost 200 plus staff. So of course within Delhi and Kolkata also someone is practicing, but if you have like patience, definitely we can give beautiful improvements. And also we need like more vision therapist. So right now we having vision therapists almost 50 to 60 members, I think, in our organization, 50 around. So definitely we need like more vision therapist. So salaries also definitely good in figures. Yeah.
Very
So
true.
as a optometrist, definitely we can practice. We have a beautiful future, because nowadays everybody using like mobiles and all. So not only CVI cases, even though like amyopia cases, even though like this different kind of disorder cases. So initially we don't have proper treatments, but nowadays we are giving beautiful treatments. So definitely across the India, we need awareness on this behavior vision therapy.
Right. Very true. Thank you. Okay, what is the effect of distraction in BVT and how it affects?
Distractions. Sorry.
What is the effect of distraction in binocular vision therapy and how it affects?
Yeah, so it depends upon, see, most of the people they having a squint. Yes, of course I have a squint, it's like visible, right? So few are having like what we call like uh, phobia cases. So definitely phobia cases, what happens, so one eye covers, right? So another eyes comes from the outer side or like from the inner side, right? So
Right.
in this condition also they having like binocular issues. So in these conditions we give like prism glasses, not required definitely squint surgery. So we give like 5 prism, 6 prism, depends upon their deviation. And we give like vision therapy also home based, depends upon child to child vary. Also for also we do prism or binocular vision therapy. So uh, if they having distractions, whenever people are focusing on the particular object, definitely they'll see properly and they'll copy and imitate. If they having like binocular vision issues also, I feel in pediatric cases mainly, so they can go with this kind of eccentric fixation. So opposite person, what he may feel like he's not giving any eye contact, he's not concentrating, but he concentrates sometime. Definitely there are like binocular issues, it affects to distractions.
Right. Okay. Okay. The next is only autism and ADHD is coming under CVI. Can you explain short note about other conditions coming under CVI?
So in future, like example, low vision. So 6 by 18, they cannot read properly, right? So yeah, of course low vision is like different, but it comes under like CVI only. So depends upon child to child. So if we are giving best efforts, still not improving 660 vision, or else like 636 vision. So in this condition, yeah, we consider like low vision, LVA kind of.
Okay. And how can we diagnose ADHD in clinic?
Yeah, so depends upon child assessment. We take like history. So whenever they come for the consultation, not only consultation, they observe mostly parents only. So overall, he cannot sit one place. he roam like anything, so he cannot give proper eye contact. He do like messy all the time in the bedroom or else like in the school. Also whenever we are sending the schools, he cannot sit at the one place, so he roam like all the classrooms and all. So definitely initially parent doesn't know, but after this after whenever he starts in the school, so from the school teachers they advise for this kind of treatments. So nowadays definitely everybody having mobiles. Why my child is doing like this, he's a bit hyper, why hyper? So they go with the Google, Wikipedia kind of thing. So whenever they come with the consultation, so we observe like child behavior, so we discuss few questionnaires, we discuss like color perceptions and all. We do like vision stimulator examination. So this kind of assessment, and we ask like questions also. If someone having this kind of issues within the family, like genetically, like forefathers, 2 to 3 generation back, right? So this kind of history we will get, and depends upon child behavior, we will consider like therapy is not only vision therapy for him, like we give like behavior, occupational, depends upon severity. And also we give like speech, because he doesn't have proper speech. So almost 4 5 therapies. And for few kids we give like CST is like cranial sacral therapy. So about fluid, we will going to be like rhythm and vibrate the brain fluid.
Oh, okay, okay. Okay. Next is how to differentiate between CVI and DEM.
Okay, so DM, I don't have exactly idea. Please, next question.
Okay. Uh, okay. Which therapy required to improve the vision autism patients basically required to improve the autism patients' vision. Yeah.
So definitely in autism cases, I discussed like they don't have proper eye contact, right? Whenever we are going with the therapies, so if you are giving occupational therapy or sensory integration therapy, or else like any speech therapy, definitely if you are giving speech, you're saying like mummy, mummy, mummy. So his age is like 2 years, still he's not speaking. Why? Because he's not capturing your lip movements and tongue movements. So whenever we are speak with the children, they observe like this, ma, me, ma, me. So this will be going to be copy and he'll try. So ma, ma, right? So this kind of actions we need like full-fledged concentration, eye contact, and less distractions, proper setting tolerance, and focusing fixation issues. Okay, so on this we will work out of as a vision therapist. So vision therapy is the first of all is the sensory integration or occupational therapy is the main important. Second is like vision therapy for this kind of children, and the third one is like speech, because with the speech we do like oral therapy. So we will put the glove and will give the muscles stimulations or exercises, because whenever I'm speaking there is no movement on my cheek, right? If I'm pulling, so there will be a movement. Why? Because the muscles are stronger. In this kind of children, they're having muscle kind of low density, low sense, low tone. So that's the reason they cannot spit, they cannot blow, they cannot they won't allow brushing. So very different issues we can observe in this autism children. So the first or second priority we can consider like vision therapy in this kind of children.
Okay. Um, mm, okay, I'm just lost 1 second. There are
Yeah,
so many questions in the chat box.
yeah.
Hold on. Okay, how can we grade, a mild, moderate, and severe? Are there any grades?
Yeah, depends upon their age. If it is like a 1 year child or 1.5 year child, so they should speak like minimum 6 7 words. If it is like 2 years, it should be like 10 or 15 words plus. So overall 2 2.5 years, they should speak like minimum 30 to 50 or 50 words plus. So if it is like 3 years, definitely full-fledged sentence. So one language they'll speak properly. So depends upon their age. If child is like 2 years, so he is not speaking even though single word, so definitely the mental age is like kind of 1 year or under 1 year, we consider like that only. So and then severity about he's like very hyper or not giving any eye contact, and he's like continuously self talk, self love, own world, he don't want to mingle with the other children. So in this case we consider like severe condition. If it is like moderate, so moderate conditions definitely this kind of behavior only there. But if we are going to call them, he may respond sometime, and if we are going to ask them to sit, so definitely he may respond or may not. So but definitely speech wise or let's like eye contact wise, he doesn't have proper coordination. So we consider like moderate condition. If it is like, yeah, he is giving sometimes eye contact, sometimes he's speaking few words like 1 or 2 words, so sometimes listening commands, so definitely we consider like mild condition. So if it is like a risk to autism or risk to ADHD, definitely they having kind of issues, the parent going to be confused, मेरा बच्चा नॉर्मल है या नहीं है. सो ये कभी कभी सुनता है, कभी कभी नहीं सुनता है, कभी कभी अकेले रहता है. सो दिस काइंड ऑफ क्वेश्चनरीज दे हैव. So definitely we consider like this kind of risk to this kind of disorder. So these all are like conditions actually: mild, moderate, and severe.
Okay. Thank you. Okay, next is how would it be possible for community optometrists to test for the autism and ADHD associated with CVI, considering both the issues are often neglected in the primary growth ages? Yeah, I think you have answered this question by looking at the symptoms and like that. Uh, okay, how to differentiate between CVI and DVM? Yeah,
We discussed exactly.
uh, DVM. Yeah. Okay, what is the normative values for saccades? Is it measured cycles per minute?
So depends upon this one also we discussed, I think.
Yeah, actually. Uh, okay. Yes, Manjula will be able to provide you the recorded version of this later. Once we upload it to the YouTube channel, we'll give you the link. Okay. How do you initiate orthoptic evaluation and in how many session you complete assessment? Because it is taking time. So in single session assessment, it is like too difficult for the patient to keep them interested in in turn to affect the findings as such. So how do you initiate the orthoptic evaluation? How do you?
Definitely, definitely it's challenging task for this kind of children. So we engage like we give like sometimes mobiles, of course, while doing
Okay.
assessment, or it's like we give like lightning objects. So then they will be focused on the particular distance objects, right? Then we will going to take prism bar, and then we will start measuring. So initially maybe first time he cannot allow, so we give like bit gap, we play with them. So we do like childish kuchu kuchu and all. So definitely after some time they'll start to give eye contact, and he'll or they will listen. So maybe it takes twice or the third time they may give like proper attention, and we will going to measure about ortho-optics evaluation.
Okay. Mm, okay. How often do you prescribe prism, and how long you wait after vision therapy to prescribe prisms?
Okay. So prism glasses mostly in foria cases, also few tropia cases, depends upon deviation. If it is like till 9 prism, we will prescribe for the children. And also if they having like eccentric fixation, if he want to see, we are naturally look this way. So few children going to be like see like this. If I'm closing their eye, so they're like again more irritating and all. So in that kind of cases we give like prism glasses for them also, around 5 to 6 prism or 6 7 prism. So depends upon the eccentric issue. And a few are like they look like this, so they don't want to up their chin. And few are like this only, so always they look down. if they want to see, they see like this. So different kind of children visits our rehab. So overall assessments we require like 2 to 3 times also, because they cannot cooperate initially. That's the reason we play with them. So we'll send to the vestibular room, so therapy is going to be engaged with them. So then again we call to the assessment, then we start about measurement of the prism glasses. So depends upon uh, about squint, and depends upon their eccentric fixation, depends upon their low and up gaze variation. So we'll prescribe till 9 or 10 prisms. So within a branch, I think 5 to 6 kids every month we prescribe prism
Okay.
glasses.
Okay. Mm. How do you assess and approach diplopia after finding out it is neurological, it is associated any neurological condition?
Okay. So diplopia definitely will go with the standard protocols. So color vision and our regular standards. So for Redford and dot test. So overall, if it is like more than 10 prism, he is accept like deviation. If patient have, so definitely we send it to surgical process only. So under 10 deviation, so definitely we will prescribe them like prism glasses. And depends upon age, if it is like below the 9 years, we will give few therapies also, like vision therapy, about that is like orthoptics vision therapy. So continuously maybe 2 months, 3 months. So depends upon child mentality. So if they are like not ready to take therapies, so in home therapies, so definitely it may extend till 6 months also. So patient, everything is like normal, he doesn't have any disorder, yeah, only deviation, definitely we will provide them like home based vision therapy. We will prescribe them like prism glasses, and we will give like this kit about prism bar and Brooksling and few heart chart and all. So for every 6 months we will call them for second assessment. So after 6 months we will again reassess, so overall how much variation occurred, so how much deviation reduced. So this kind of like all the about history we will consider, and if needed to change the glasses, yes, we will change, we'll reduce the prism and will give a new prescription about prism glass prescription. We reduce the prism in second time. So for this kind of children, yeah, it may take like 1.5 year for uh, deviation of like ortho condition, it will come.
Yeah. Okay. That's great. Okay. Okay, so can we get your contact and email ID? Yes, Snowbar, will be able to share his contact details if he doesn't mind. We'll email it to everyone. Uh, okay.
As an optometrist, definitely we cannot do more and more. We
Yeah.
cannot prescribe definitely high prism glasses. Yeah, it may be risky for patient also, even the practitioner also.
Okay. Mariswari is asking that she's an optometrist and would like to start her career in low vision therapy. So she doesn't know where she should start. So anything, any guidance to her?
Depends upon if it is like low vision, definitely within metro cities only we having good choice. So all the 5 metro cities you can start anywhere, but you should go with the about a retinal specialist. So definitely they'll send more cases, and you have to visit other doctors also in pediatric and gynecologist, because depends upon if you have like more what we call team about doctors team, so they'll refer you more cases, and depends upon your patients, so you can refer them like different wings also. So this is like mutual understanding.
Yeah. Right. Yeah. Co-management always helps in such cases. Yeah.
Yes, yes.
Okay. How do you improve eye contact in cases of autism? Which all visual skills do you work on?
So we having like in this three levels actually. So level one, level two, level three, and level fourth was like system based vision therapy. So yeah, all optometrists they know about binocs and revital vision. So these things we consider like fourth grade vision therapy. So in level one condition, definitely they having like different issues. So that's the reason we cover on the converge, diverge. So in autism ADHD kids, they cannot see properly. Okay, so if I say so, give the eye contact on my finger. If I'm doing converge, diverge for 1 hour, yeah, we are normal, right? But this kind of kids, they cannot give eye contact. Um, Max to max 4 5 seconds. After that, they'll distract. That's the reason we work on like level one, just converge and diverge. The level two is like we give like example pursuit moments. So I'm just moving this pen, okay, slowly. So he'll distract. Hey, look on this. So he'll try to look and again distract. So this should be like at least 15 to 20 seconds. So he should follow the object. So third level is like saccadic movement, anything. Okay, so however like I'm going with this he should cooperate. This is like normal kid, right? So they cannot. So step by step we will improve their eye contact. So three
For
levels.
that, okay. Uh, how do you use yoke prisms in the therapy?
Come again, please.
How do you use yoke prism in therapy?
York Prism. Okay, so very few York Prism because we don't practice full-fledged York Prisms in these conditions. So there's a reason we give like under 9 prisms only. So after above 10 or 12 prism, we will prescribe this kind of York Prism glasses in neurological conditions.
Okay. Do you have any workshops for learning about these cases and vision therapy, or any courses you would recommend for the students, especially? Yeah.
Yeah, so I personally visit twice or thrice in a month. I mean, like, sorry, every 3 months or 4 months, I'll visit different colleges, optometry colleges within Hyderabad. So also DY Patil and also in Jaipur. So definitely, if someone is like interested, definitely we will provide workshop.
Okay.
Yeah. So all the therapies we can discuss with with vision therapy also.
Okay. Okay. How can an orthoptic instrument can be used to correct? One second. Used to used for behavioral vision therapy. How can
Orthoptic
orthoptic
instruments.
instrument can be used for behavioral vision therapy?
Yeah, depends upon child age and their mental age and their severity. We will use like synoptophore also comes like right. So we will use stimulations. So setting tolerance improves. So eye contacts continuously. They'll listen our commands and overall name calling response improves, right? So and also about brook string. This is like a small string, but it comes in every department actually, CVI cases, accommodation cases, and as like behavioral vision therapy, and also for orthoptics cases. So if they having like exo, right? So they cannot appreciate on particular beat. So we will give prism glasses. Then we will try to convince them to try to look on the particular beat. So he'll try slowly. Then after a few months, definitely he'll appreciate the binocular vision. So depends upon prism and depends upon deviation and depends upon severity. It may take more time, I think, for this kind of cases. Mostly 1.5 year orthoptics cases. We will definitely use behavioral vision therapy also.
Okay. Thank you so much. Dr. Kiran has posted his email ID there. So if you all have any questions, you can directly email to him. I think we are past 5 o'clock, so we should end here. Thank you, Dr. Kiran, for giving your valuable time to us. Stepping up to meet the lots of challenges posed by CVI. requires very bold actions, and the potential for impact is too great to pass by. So we need to take steps now to ensure that all the individuals with CVI have the support they need to live their, best lives. So thank you so much, Dr. Kirin, for us raising awareness. It was a great talk, and thank you all the participants for joining the session, and a big thank you to the OCI